Hi, Jane. It's so good to see you. Welcome back. How are you feeling?
Um, I'm all right. I'm
Mm,
all right.
okay.
Yeah.
Last time you and I met, we were talking about your assessment results. Do you remember that?
Can you run me through it?
Yeah, so we had run all your testings and I was reviewing your results and we spoke about you having major depression with moderate symptoms. And
Yeah.
we possibly discussed that next time I'm sorry, that we could talk about options.
hmm
How are your symptoms this last week since we met?
Um, it's about the same. I mean, I wake up often during the night, just not so pleasant. Sometimes I wake up angry, sometimes I wake up sad. And then just, I don't have a lot of motivation toward many stuff. I don't know. I just want to give up in many ways, but not like, not like I want to give up on my life, but I don't see much motivation to, yeah, like live either, if that makes sense. Like I don't feel much joy or, stuff like that.
Okay, so can I clarify, are you in any danger of hurting yourself in any way?
No.
Okay, so is it more of just you're not feeling like the joy of life of feeling like getting up and things like
Yeah.
that? Okay, so it's still like the same symptoms that we were feeling.
Yeah.
And so you're having this diagnosis of, of major depression with moderate symptoms is um, aligns with what you're feeling. And we've been working with a few sessions, we have been doing some coping skills and things that we've been working on. And do you feel like that you're feeling better with these things that we have been trying?
I mean, at the moment, I guess I feel more, relaxed, but just getting to the point to try those skills is very hard for me because, yeah, like I don't have much motivation.
Mm, I see, I see. Well, I want to commend you that you keep coming back to therapy. It takes a lot of courage to, especially when you don't like the motivation, showing up shows a lot of courage. I wanted to bring up a topic with you because it looks like you're still feeling the symptoms very much, and it seems like you're not feeling a whole lot better with them. How do you feel about possibly seeing a psychiatrist? And what a psychiatrist would do is a doctor for mental health. And what he does is possibly prescribe maybe some medication to help you with your depression. How do you feel about that?
I am not sure because I've never thought about taking a medication I don't know, for mental health problem. Because I don't know, that sounds like too strong for me.
Mhm.
Yeah. Um, I feel like taking the medication, like, I don't know, because I feel like if I do take the medication, maybe I would feel better, but only while taking the medication, right? Like that wouldn't be permanently treated. If it permanently treats, then I would maybe be open to it, but if it's just like a pain reliever for that moment, I don't see any point of taking the medications.
I see, I see. I understand and I hear you because on the one hand, you feel like it would help you just like a relief, kind of like a headache medication, right? On the one hand. But on the other hand, like if you stop taking it, you feel like your depression would come back. Am I getting that right?
Yeah. Yeah. Just like just like Tylenol or Advil, it's just for that moment. And I think that means I have to take the medication forever, but I don't want to do that.
So yeah, so your worry is that you would be dependent on the medication to feel better with your depression.
Yeah, and just putting something in my body compared to just a temporary relief, I don't think that doesn't really make sense.
Mhm.
Yeah. And then also like side effects too. Like um I don't take any of the like pills that much except for like vitamins, but before I took birth control for about a month for my skin condition,
Mhm.
but it made me feel like so numb and just like feel nothing. And yeah, I really didn't like that experience.
Yeah, I absolutely understand. There's a lot of people who are very holistic with their health and they try to use alternative ways of treating their bodies. And so I understand. I'm sorry you had a bad experience with birth control. Um, but I wanted to like bring up that topic because there's a lot of people who are torn with medication, especially where there's so much out there with misinformation or information with especially like with media where you hear these commercials. I don't know if you're familiar with that, and you get bombarded. And so I understand your concerns and the issues. So I get it. I get it. And I want to congratulate you that you are informed with wanting to take care of your body and wanting to be healthy um, in that area of your wellness. But are you very familiar about mental health medication in general?
Not that much. Like not as much as I know about like Advil or, Tylenols. Yeah, but yeah, I that's what I know. Like it's not gonna treat you permanently. It's not a cure. It's just a temporary relief. Yeah.
Okay, so let me ask you a question from 0 to 10. Zero not being very open and 10 being very open. Um,
Mhm.
how open are you willing to hear some information about just medication about depression that I can give you? Zero
If
not
I
open, 10 very open, sorry.
Yeah. Just hearing about the information, I'm open to it. Yeah. 8. Yeah.
An 8, okay. So can I give you some information a little bit that
Yeah,
you can
sure,
tell me
sure.
about? Basically, since you said you don't have much information about it, um, there is a range of depression medication that you can take. And basically, how they work is that it helps regulate your serotonin, which is what regulates your mood, especially your ups and downs, right? So it regulates your serotonin, so it makes your levels level, so you don't feel the down. And so what it does, it just levels it and makes you feel a whole lot better. And it usually takes a few weeks to kick in. And in a few weeks, you start feeling the effects. And the whole point is for it not to be long term. And in the case of your situation, we talked about it in your depression. You haven't suffered it long term. When our sessions, we had talked about it. Um, it just came on recently because of your loss and whatever we discussed. And so it doesn't have to be long term necessarily, especially because you're pairing it up with therapy, or who knows. Your psychiatrist would obviously talk to you about the situation, whether how long you need to take it. So it's not necessarily a permanent thing, like you had mentioned. I know you were worried about that. But your psychiatrist would give you more information about that. So if you take it along with therapy, you can create a plan with your psychiatrist along with me, and it can help you alleviate the symptoms. And in the dosage, you can determine along with your psychiatrist what you need to take. And it doesn't also change your personality. It just alleviates the symptoms by um, leveling your serotonin levels. Does that make sense?
Yeah. But then what happens after I discontinue?
So, and that brings me to a good question. If when you discontinue, you do have to be careful with it. You have to work with your psychiatrist because some of these medications you can't just take from one day to another day, just stop them. You have to like slowly start discontinuing them because, like I said, they do regulate your serotonin. So you kind of have to slowly start taking them um, little by little from your system, so your body doesn't go into shock. But there, you absolutely can't get off of them with the direction of your psychiatrist or a doctor's um, advice. And you did talk about side effects. Some of the side effects are usually in the beginning. Some people experience like nausea or dizziness, and some of them will feel sometimes a little bit of anxiety when they start taking them because of the changes in their body. But those are short-term effects that they feel in their bodies. But then they get acclimated after a few weeks. Do you have any other questions?
Yeah, so I mean, like when I discontinue, will depression come back?
Well, that all depends. That all depends on your body and your system. It all depends if you are working with your psychiatrist and your therapist, and let's say that your depression was seasonal. Seasonal means that it was a one-time episode that you just went through something in your history, right? Um, an event that happened to you. Most likely, if it was just one event thing, probably not. But if it's a long-term um, depression that you have suffered in your history, it probably could mean that maybe could be a long-term solution that you may or may not need the medication long-term. Does that make sense? You may not be dependent on it, is what I'm saying. Eventually, you may learn to live with your depression once it's balanced and you learn how to live with it with other coping skills. The whole point of the medication is right now that your symptoms are so severe right now that you're not able to function with the symptoms that you have. They're impeding your daily life. Does that make sense?
Yeah, yeah. But it
Yeah.
sounds like, yeah, depression is something that's not gonna go away. Yeah.
Have you had depression your whole life? Or is it something that just happened to you?
I guess it's I don't know. I guess it's sometimes I do feel this way, and then it goes away and then it comes back. Yeah. And then same cycle.
That's exactly my point that we were talking about right now, that it seems to be that right now you're just in the stage where it's impeding your daily living.
Hmm.
So for right now, something you may consider. I'm not trying to convince you either, or it's up to you if you want to visit a psychiatrist to talk about it. Because what it will do for you right now, if you decide to do it, is just help you alleviate these symptoms along with therapy. And when you start feeling a little better, you can decide whether to get off of them and then just use the coping skills that you have. So then you can start going and just use the coping skills to start going on the up. Does that make sense?
Yeah, yeah, that makes sense. Yeah.
But it's up to you. I mean, it's a big decision and it's your body. And also like just going to the psychiatrist doesn't mean that you're going to get on it as well.
Mhm.
It's
Yeah,
just for you to get informed, and you can ask even more questions because he's a medical doctor. Can give you even more detailed information.
that makes sense. I think I can, you know, at least, consult with the medical professional and just get the information, more information.
Absolutely. And in the meantime, we can continue doing those mindfulness exercises that we're doing and the coping skills that we're doing and you journaling, when the low points are happening and the small steps that we've been taking, right? Like when it's hard for you to do tasks and we've been doing little milestones, right, to tackle those hard things for you to do, and then we're slowly taking steps to get them done. And we'll continue all those things, absolutely. And of course, we'll go at your step, at your range, and we'll continue to work on those things.
Yeah, that makes sense.
Yeah.
Yeah, I'm open to it.
Yeah. So do you have any other questions, Jane, about
No, I think, yeah, I think that's all. And yeah, I think I would get some more information from the psychiatrist, not necessarily because I want to, get on the medication, but as you said, getting some professional advice or information from the medical doctor would be, would clarify my confusion. Yeah.
Absolutely, absolutely. And whatever you decide, I will support you and let's continue with the therapy. And I can also give you more psychoeducation on if you want on antidepressants as well, if you want to.
Yeah.
Okay.
Yeah.
All
Thank you
right.
so
Thank you.
much.
It's so nice to see you, Jane. We will see you next time.
Thank you. Bye.
Bye.